Yeah. We'll begin in 1 minute. Call a meeting to order. Please stand for the Pledge of Allegiance. Ask City Clerk to please record attendance.
Mayor and council members, as we are not all in the same location this evening, please respond with present when I call your name. Brink,
Present.
Collins,
Present.
Corbett,
Present.
Wendell.
Present.
Council members Niemeyer and Tilton Burn are joining our meeting, starting with the executive session portion.
Okay, thank you. Council, this time we're going to be going into executive session. And so executive session pursuant to South Dakota Codified Law 1-25-2.1 for discussing the qualifications, competence, performance, character, or fitness of a public officer or employee or prospective public officer or employee. The term employee does not include any independent contractor. Council, I'll entertain a motion to go into executive session.
So moved.
We have a motion and a second. All in favor, say aye. Aye. Opposed, same sign. We're into executive session.
Much better. Yeah. Gotta wait to get the staples out next week, then I can start physical therapy.
Okay, we're out of executive session, reconvene the meeting. Council, on the consent agenda, I would move to amend the consent agenda to include a proclamation. Can I have a second on my?
Second.
Okay, we have a second. Any discussion, council? Please call the roll.
Brink,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell.
Aye.
Okay, thank you. So now, entertain a motion to approve the agenda as amended.
So moved.
We have a motion and a second. Any discussion? Seeing none, please call the roll.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Brink.
Aye.
Okay, the agenda is approved. There were no items removed from the consent agenda. So at this time, then, open forum or presentations. Anyone care to speak to the council on a topic that's not on the agenda tonight?
Hello, Bradley Walker, resident of Brookings. Tonight's comments are on regarding your COVID updates and thresholds. First of all, I would like to know why this meeting was moved up instead of occurring on the regularly scheduled fourth Tuesday of the month. Is there any
It's
special-
because the fourth Tuesday is the week of Christmas. It'd be the 22nd, so we moved it up to tonight, so we didn't worry about people traveling.
Okay, that's what I figured. Like I said, the ordinance doesn't expire until the 28th, so you really didn't have to move it up. So you moved the meeting up so that you can start your Christmas vacation early while telling the public to cancel Christmas and only celebrate with your own household. When is the next scheduled meeting? Is it the second Tuesday in January, which would be the 12th? Is that correct?
That is
I
correct.
looked at the schedule, there's no meeting scheduled at all on the calendar for January. But I'm assuming you're going to go back to revert. to the
January
regular-
12th is on the agenda for the,
When I looked at the calendar, it wasn't
okay, you
on.
might want to go back and look at 2021 calendar.
Anyway, that's a month from now. So if you decide to extend the ordinance and all the thresholds are met to move to the next phase, no action will be taken for another month. You keep claiming that you can review and amend the ordinance at any time. But the only time you have taken any extra actions was to extend it once again, such as in November, when you had to have a first reading so you could have a second reading before the ordinance expired. Speaking of moving to the next phase, in your COVID update last week, you conveniently neglected to inform the public that the first criteria had been met. The RT number has been under 1 for 25 days now. November 20th was the first day that it went under 1. Almost double the time that you require. You require 14 days. Not only in Brookings, but in all of South Dakota. So by your figures, the epidemic is under control, statewide. Then I read in the paper that you recommend extending the ordinance because all measures have been triggered to some degree. This is false. The first two metrics, standards for ending the ordinance have been met for some time now. And then we have phase 4, return to new normal. How can you return to something that never was? You can return to normal, which was the way things were a year ago. A year ago, I was in Sioux Falls attending a concert with hundreds of others standing shoulder to shoulder, singing and dancing and enjoying life. That is normal. Mr. Wendell said on national TV that we have normalized mask wearing in Brookings. I disagree. Mask wearing is not normal. If it was normal, you wouldn't need a mandate because people would just do it. Why? Because it's normal. Wearing a mask when you are driving alone in your car is not normal. I know that you've all seen that happen. Wearing a mask when you're walking down the street by yourself with no one around is not normal. Having a group picture taken with masks on is not normal. You might as well just turn your back to the camera because no one can tell who anybody is. Not shaking someone's hand or hugging a friend when you greet each other is not normal. There is no new normal to return to. The only thing to return to is the way things were before the virus outbreak. Thank you.
Okay, anyone else care to speak to the council on a topic that's not on the agenda tonight? Seeing none, close the public forum. This time I'll call on our CFO. I think you have an introduction.
Good evening, council members. I would like to introduce Bill Helt as the new liquor store manager. I'll let him introduce himself, but we're very excited to have him on board. He's got over 18 years in retail experience, and I'll let him talk to you a little bit more about himself.
How's everybody doing tonight?
Great.
Good, all right. I'm Bill Helt. I'm a local. I grew up here in Aurora. Went to high school here at Brookings High School, graduated, and I've worked through town. Worked over at Lowe's for 13 years in management, and now I've been running the bus garage for Brookings. Is my last one for the last 5 years. So, and like I said, just been around Brookings and been transportation director for the last 5 years. And both my kids go to college. Got one in SDSU, and the other one is in Orange City, Iowa. So, and then my wife works for Swiftel. So, you guys got any questions for me or anything?
Welcome aboard.
Yeah,
Welcome.
Hey,
congratulations.
thank you guys.
Thank you.
Exciting.
Mayor, if I can, Bill is a little bit modest here. He's been working for retail for quite a few years as, I believe, an assistant manager in Lowe's. But more importantly, recently he's been working as a part-timer at the liquor store because he loves retail that much. He just couldn't get away from it. And so I think it's that type of drive and determination that we look forward to having you in the liquor store and helping to grow that team and continue to make those sales happen for our store. So thank you. I'm
Yeah,
excited
appreciate
for
it.
you to be a
Thank
part
you,
of the
guys.
team.
Okay, this time then we'll open public hearings and second readings. I'd ask city manager to introduce ordinance 20-029er.
Thank you, Mayor. City Council members, the current ordinance is set to expire at the end of December. Tonight, Council will hold the second hearing to extend the current mask mandate and occupancy regulations tied to the ordinance. If approved, the existing ordinance will be in place for another 60 days. The current regulation does require 50% occupancy at restaurants, bars, grocery stores, casinos, and gyms. At restaurants, bars, there is a requirement to be 6 feet between groups of 10 or more. When social distancing cannot be achieved for all indoor businesses or indoor public places, face coverings are required. There are a number of other exceptions noted within the ordinance, and tonight, during the public hearing, SDSU, Brookings Health, Avera, Sanford, and others will give council and the public an update of the current conditions. However, prior to that public hearing, Mayor, I know that there is some announcement that you would like to make.
That's correct. Thank you. At this time, I'd like to have a mayoral proclamation. And it's whereas the city of Brookings benefits from contributions by individuals, community, a better place to live. And whereas one such individual is epidemiologist Dr. Bonnie Specker. And whereas Bonnie has been actively involved in the COVID-19 pandemic mitigation efforts through South Dakota State University Division of Research and Economic Development, and whereas Bonnie has been devoted to providing accurate information through the daily distribution of data, as well as weekly, regional, statewide, national, and worldwide updates. Whereas Bonnie's efforts have assisted all those making informed decisions. And whereas Bonnie's demonstrated commitment to the greater good of the community and public health sets an exceptional example of what it means to be an outstanding resident. Now, therefore, I, Keith Corbett, Mayor of the City of Brookings, South Dakota, do hereby proclaim Tuesday, December 15th, 2020, as Dr. Bonnie Specker Day. Okay, Council, I'd entertain a motion to approve the ordinance 20-029er?
So moved.
Second.
Okay, we have a motion and a second. Now, at this time, I'd open up public comment. I think City Manager, you had some first?
Yes, I believe we have a number of people on the call virtually to give a quick update during the public hearing, starting off with Bonnie Specker.
Thank you, and thank you to the city council. That was pretty much of a surprise. I do think it's important to try to educate the community about basic epidemiology so that they can understand what's going on with this pandemic a little bit better. Today, I'd like to present the most recent Brookings County data. I'm not sure how that gets put up there. There were slides sent to Bonnie. Okay. So as seen here, the number of cases per day peaked in November and it's been declining since Thanksgiving. However, it's important to note that the number of cases is still above substantial spread. Substantial spread is defined as 100 new cases in the previous 7 days per 100,000 population. For Brookings County, that translates into 34 cases per week, or about 7 cases per day. So we really need to be setting that as a target in order to get it out of substantial spread and move down more into moderate spread. Next slide. So this slide shows the cumulative number of cases for the counties with the top 10 most populous cities since July 1st. And I started it at July 1st just so that the more recent parts are a little bit bigger. What's important to note here is that Brookings was in the middle of the pack at the time the mask mandate passed in September, when the increase in Brookings started to flatten out compared to the other counties. And you can see that with that yellow line kind of flattening in September. The steeper these lines are, the greater the increase in the number of cases. Brookings County has had the lowest cumulative number of cases per population out of these 10 counties since November 19th. The lines that are solid in this graph are counties that passed mask mandates as either an emergency order, resolution, or ordinance. The asterisks at the bottom of the graph indicate the date that the mandate was passed, and it's also written there in the text. Next slide. This graph shows the average number of new cases per day over the last 7 days per population size. So, since substantial spread is defined as 100 cases for the last 7 days per 100,000 population, this would translate into 14 new cases per day with this axis of average number of new cases over the last 7 days. Fortunately, the rates are currently dropping in the majority of the counties, but we are not out of it yet, as all 10 counties still are in substantial spread. Note that the counties with mask mandates prior to December 1st have declined to a greater degree than those counties without a mask mandate. In fact, if you look at the percent decrease for all of these 10 counties combined, it averages 45% between November 15th and December 14th. The 4 counties where the largest city passed a mask mandate before December 1st, average decrease of 69%, and the counties without a mask mandate have had a decrease of 40%. And I picked December 1st as the cutoff because those counties that passed it, the mandates in the last week or to 10 days, there really hasn't been enough time to have that reflected in the data. Also of interest here, I think, is that Brookings County, which passed that mask mandate in September, had the lowest rate of new cases per day per population among these 10 counties for the entire month of November, which was when South Dakota had its peak number of cases. Next slide. Currently, recommendations from the White House Coronavirus Task Force, the Harvard Global Health Institute, and the CDC, the recommendations for Brookings County are that based on the rate of new cases and the test positivity, the recommendations include mandating mask use in all indoor space and by everyone outside their homes. They also recommend that gyms should be at a 25% maximum capacity, that all gatherings should be limited to 25 people, that bars should be required to close, and that restaurants should have strict social distancing guidelines for indoor dining. I think that continuing the current resolution or ordinance will allow the city of Brookings to meet some of these recommendations. It has worked, and we really need to be persistent. Things are not normal. We are in the middle of one of the worst pandemics this country's seen in over 100 years. That's all.
Thank you, Dr. Specker.
I believe we have Jason on the line next. Jason Merkley.
Thanks, Paul. This is good evening, council and mayor and other city staff. Jason Merkley, President and CEO of BHS. Thanks for the opportunity to provide an update tonight. First, congratulations to Bonnie, a well-deserved recognition. And then just a status, I'll keep my comments fairly brief, answer any questions that you may have if there are some. At the hospital, we have gone through certainly some stressful times. We have seen hospitalizations get up there to test our capacity and our level of ability to care for individuals in our community and the surrounding area. Thankfully, as Bonnie pointed to some of the data, there looks to be some kind of cautiously optimistic trends happening there from a standpoint of seeing less hospitalization. So we still have a significant number, but less than previous. Our challenge now becomes managing that as we have what happens every winter and certainly in December is an increased census for all other things that need to be taken care of from a health standpoint. So our inpatient census continues to stay high and certainly stressful for our staff in taking care of individuals. But COVID numbers have gone down recently, which is, again, a good trend and nice for us to see from that perspective. I would say, our message here is to stay vigilant. We're coming off of obviously Thanksgiving and the holiday coming up here next week and Christmas and New Year's. And stay vigilant on those precautions and guidelines that are recommended. We certainly would encourage the council and the mayor to hold the course on the ordinance. As Bonnie presented, we feel like it's making a difference, and it's nice to see us leading the state as far as those mid-sized facilities. So with that being said, I'm happy to answer any questions, but that's kind of my report.
Alrighty, I believe next we have Patrick with Avera.
Hey, good evening, everybody. And thanks, Jason, and I'd like to thank the council again for both your early actions dealing with COVID-19 as well as your continued diligence. My name is Patrick Sigling. I'm the clinic director for Avera Medical Group here in Brookings. We've talked about it, Bonnie and Jason, but numbers are improving. When you look at the number of cases, percent positivity, looking at hospital census. When you think about hospital census, I would just encourage the council to take those numbers with a little bit of a grain of salt, just because, like we've talked about in the past, we have currently in the state thousands of individuals across the state that are being monitored at home closely that might otherwise be in the hospital. And we have hundreds of individuals that are just in general medical beds throughout the state that otherwise might be in an ICU. And people that are in an ICU right now are very ill and require a great deal of care. We've talked about it. It's been said in the past, but I think we're at a point in this pandemic from our perspective where our most important resource isn't the testing supplies anymore. It isn't the available hospital beds or the PPE, but it's the people that are really at the front lines of this thing, our frontline caregivers. When you talk to our doctors and our nurses, our lab staff, respiratory therapists, and others, you get the sense that yes, they're tired, but they're giving it everything that they've got, and they're going to continue to give it everything that they've got. I talked to one of our physicians earlier today just about being at the bedside of a patient with COVID-19 at the end of their life, and the patient just having a will and a want to live, but ultimately succumb to COVID-19, and just the physician carrying that with them here even this week. But so yeah, they're tired, but there's also a sense from the people on the front lines that there's hope, and we're going to make it. We have improving numbers. We have vaccines that are coming to Brookings County starting here yet this year. And from my perspective, I think with the continued diligence of the community and stopping the spread with measures we have in place now, we're going to make it through this with a healthier community on the back end, as well as a very thankful group of frontline healthcare workers. So with that, that's what I would have to say, and I'd be happy to take any questions from the council.
Thanks, Patrick. I believe Amy Sanford's on the phone as well.
Hi, this is Amy Hackett, RN Clinic Director at Sanford and Brookings, and thank you, Mayor Corbett and council members, for the opportunity to speak. I can't say it any better than Jason and Patrick just summarized it. We are in agreement and work with our healthcare partners and would recommend to continue with that mask mandate. With Christmas and the holiday season coming up, the behaviors over this particular time will show the second week of January, which is when the SDSU students would come back. And I agree with Patrick, the healthcare workers are doing everything they can. And it does hit you personally when you're working with some of these patients. But we would support that effort, and just thanks for your support in the community.
Thank you, Amy.
And I believe we have Clint Willard with the Public Schools Online as well for an update.
Yes, good evening, Mayor, councilors. Thanks again for the opportunity to share and to comment. As a superintendent of schools, I just want to begin by sharing my sincere appreciation for the work that everybody's done. And in particular, I'm going to offer my appreciation for the work of our students, our staff, and families, as we've all continued to navigate this, what we know is at times a very tumultuous water through the global pandemic. Really, it comes down to the fact that we have a plan that's in place, and it emphasizes the best practices that have been promoted through the council with the ordinance, practicing those things that we know work. Physical distancing, wearing masks, practicing personal hygiene, and proactively cleaning and disinfecting. And those are all the practices that we continue to emphasize in our schools to provide a safe and healthy learning environment for students and staff. And as I provide this update this evening to the council and frankly to the community, I'm very delighted to report that not only do we know those practices have worked in the school district, our plan is really continuing to provide a safe learning environment for all. And at this time, at the time of this presentation, the Brookings School District has 7 actual live active cases of COVID requiring isolation. That means active COVID cases, and 28 individuals on quarantine as a result of having close contact with one of the confirmed cases. And we know that what has happened has not always reflected positively in South Dakota, but I believe that I can say Brookings and the Brookings school districts remain resolute in our approach and what we're doing. And I know that as we sit here this evening, we are committed to many of the same things that the council is excellence. And we know that in doing so and committing to excellence, we're following the standards and guidelines presented and provided by the CDC and the South Dakota Department of Health. I would just urge the council to continue supporting and advocating for excellence in the practices that allow our community and our schools to successfully function. I support with the council and community in collectively working together to keep business going by applying the same standards and practices we know that make a difference. Masking, appropriate hygiene, following the CDC and South Dakota Department of Health, encouraging everyone to practice appropriate personal responsibility, and practicing appropriate physical distancing. So I'd be remiss as I close not to take time to applaud all the hard work that's going on in our school district and across the community that represents our Bobcat family. We know from our classroom teachers to our transportation personnel, by the way, you picked up a good one with Bill Helt, from secretaries to student teachers, from teacher assistants to child nutrition workers, our administrators to our coaches, custodians to support personnel. Our team has been dedicated, much like the council, to serve the students in our community in a way that is safe and prudent. And we know that this can only happen through the continued support of our students, our parents, and our community. So thanks again for providing time for us to highlight what's going on in the Brookings School District. And I do stand ready for any questions that might come from the council as well.
I don't see any, Dr. Willert. Thank you.
And I believe the last presenter we have is Daniel with SDSU.
Good evening, Daniel Scholl, resident of Brookings. I'm speaking on behalf of South Dakota State University. Mr. Mayor and members of the council, thank you. Thank you very much for taking the lead in stimulating, fostering partnerships across the entire Brookings community. We at SDSU are very happy to look back at our partnership with the council, with the city, and with the entire community over the last academic semester up to the Thanksgiving holiday. We successfully navigated the semester because of our concerted efforts together, and I'd like to share with you a few highlights of the results of this last semester and how we did it, and then inform you how we're going about planning for our spring semester. First of all, we conducted nearly 4,000 tests for COVID-19 among SDSU students during the semester. And in the last several weeks, the average percent positive of those tests has been 10% or below, which suggests a combination of effective arresting of transmission of the virus among students within the student population, and a depth of testing that is sufficient to identify a large proportion of asymptomatic cases. This declining positivity rate is a product of the actions that we've taken together. Testing is a measure of the outcomes of the work, but the work at preventing COVID-19 transmission within the university environment comprises careful, rigorous planning for events, having events, but planning them very, very carefully. Housing service delivery, the way that we manage student housing, adjustments in our work patterns, our workflows, the densities and rotations of people in our offices, de-densifying our teaching, and then effective testing and isolation. Our on-campus quarantine and isolation housing program proved to be effective, and it was at all times sufficient. We were very pleased with that and confident that it will serve us well going into the spring semester. As we head into the spring semester, we plan a campaign for students to encourage 2-week pre-arrival quarantine. Testing will remain available for students as it has. We're able to conduct, at baseline levels, to conduct 186 tests per day, Monday through Friday, which is a rather large volume of testing capacity. And we'll maintain the policies and actions that we have in place that have worked well to enable a successful navigation of the fall semester. So for SDSU, our plans and practices, as we've implemented them, will remain in effect. And our recommendation to the rest of the community, our encouragement to the rest of the community, is to continue to be cautious about transmitting COVID-19, and especially being aware of the risks associated with holiday celebrations. In summary, the efforts that have been working that we should maintain are to aim for low density of people in all settings, use masks when we are around people, observe careful hygiene, keep our sicknesses at home, and plan events with rigorous attention to prevention of close contact and high touch that would increase the chances of unknowing transmission of COVID-19 from one person to another. As I close, I'd like to take the opportunity to thank the healthcare system in particular, who have been the leadership of the healthcare system, people who I consider friends and colleagues who have been on the front line of fighting for our community's health and advocating for smart and intelligent preventive practices. And I would very much like to congratulate Dr. Bonnie Specker for her recognition and for today being Bonnie Specker Day in Brookings. Thank you.
Thank you, Dr. Scholl. I think Councilman Wendell, did you have a question?
I did. Thank you, Mayor. I had a question that might be most appropriate for one of our healthcare providers. I have noticed this week that we've seen a fairly sharp decline in the number of tests being reported in South Dakota. Some days we were reporting more than 4,000 tests per day, but recent days that's been just over 2,000 tests reported each day, and it's just made me wonder if that's because demand in our state has decreased or if something in the protocol has changed, and if the testing volume has anything to do with any of the recent trends we've seen in numbers this week.
I can maybe start. This is Patrick. I would say for us, there's been no noticeable decrease in demand for testing. Our numbers have been pretty consistent with what they have been in the state. We do know that some of the pharmacies have started offering testing, which is a great thing. The more testing that we can do, the state is offering some at-home kits. So we're probably not at our peaks for testing, but it hasn't been a substantial decline for us.
This is Amy at Sanford. I would agree. We haven't seen a decrease in the amount of tests we're doing either. And I agree with everything Patrick said about the other places which is great that folks can get tested.
This is Bonnie, and I just want to say that with the 4-day weekend over Thanksgiving, there's going to be a lag in reporting results, and then that backed into another weekend where, typically Monday and Tuesdays are very low reporting days because those are days that are reporting what happened on Saturday and Sunday. So I think the Thanksgiving long weekend kind of threw a wrench into some of these numbers.
Okay, thank you.
And this is Jason. I would just add that I think Bonnie kind of hit the nail on the head there. I think there's a little bit of lag in some reporting, and we're probably seeing not quite as much demand out there. I don't think there's any backlog in testing that's occurring within the state at Sanford, Avera, or certainly here at Brookings Health System. We're still processing those at a pretty good clip. So my guess is it's just a matter of less people coming in to get tested, Nick.
Mayor Corbett.
Yes.
I have a similar question kind of along those same lines. As we've kind of been watching the number of tests that are administered and kind of seeing this trend that having more tests would be better to help us better understand the current climate around the pandemic, both kind of locally and statewide. I'm wondering if anyone on the call or available has any suggestions on what we could do to increase that number. Does it mean testing more asymptomatic people? Does it mean making tests more readily available? What can we do to increase the number of tests that we are seeing?
Holly, I think some of the people don't want to get tested because they don't want to have to quarantine until they get their test results back. So I think letting the public know that the turnaround is really short now, that they won't have to quarantine. I mean, they will if it's positive, but they don't have to quarantine for very long until they get that test result back. To me, the group that's probably not coming in as much as they should are people that are contacts of cases. You know, I think it would be important to try to get them in for testing, and that would help identify some of these people and get the test positivity down.
Well, and Holly, I would just add that, you know, they did have some stand-up testing sites across the state that they did at one point in time. I don't know, honestly, how successful they were. And so those were obviously some of your drive-ups in different cities across the state. And although I do think they certainly did a fair amount of testing there, I don't know if something like that would mean more testing. So those are things that come to mind. I think education is certainly key there, as Bonnie touched on. And I do agree with her that close contacts are probably some of those individuals that are choosing not to be tested potentially.
The only thing I might add is, yeah, we do have plenty of testing supplies at this point, and so how do you encourage more testing? I do think it's just public education of just letting people know if they do have symptoms, even if they're mild, get tested just to be sure, make sure you're protecting those around you. And if you are asymptomatic exposed, another great opportunity, those people should be tested as well. So I think from our perspective, we're okay on supplies, and so now it's just public education to encourage people to test.
Yeah, Councilmember Brink.
Yeah, maybe a follow-up question to that. I think a few weeks ago, we were maybe not in a position where we were able to test everyone who was asymptomatic that maybe presented and said, I think I might have been around somebody who had it. And I just wondered if what I'm hearing is correct, if that has changed, and an asymptomatic person who has a reason to believe that they've been exposed can get a test here locally with no trouble.
This is Amy at Sanford, and yes, we can do, we do the asymptomatic testing. We have them wait 7 days from that first date of exposure, but no problem there with the supplies or the ability to get those done.
Thank you.
Agreed. Same for us.
Mayor Corbett.
Yes, please go ahead, Councilmember Tiltonburn.
Another kind of follow-up on that. I'm wondering if anyone on the call can clarify, for some of those testing sites that maybe aren't a clinic or the hospital, I'm specifically in Brookings thinking of the Hy-Vee drive-up testing that happens, the Brothers Pharmacy drive-up testing that happens. Do those test numbers get reflected in the overall numbers that are reported for tests as well?
Yes, Holly, they should be reflected in the state numbers.
Mayor Corbett?
Yes, go ahead, Councilman Niemeyer.
Question on the vaccines that are coming. Do we have any timeline for our area as to when we should expect vaccines to be administered to the healthcare people and our assisted living and nursing home residents?
This is Jason. Yes, I can tell you that we have vaccines arrive today at 3 p.m. We've been working diligently through a laundry list of ways in which to make those things work within our internal workforce. And so we have vaccination clinics that will begin on Thursday and Friday for those phase 1A priorities that have been identified by the Department of Health and I think even by the CDC. And so as we get future allocations, we will continue to meet those expectations from the standpoint of getting those individuals vaccinated that are on the front line. That would include long-term care workers, assisted living, obviously healthcare workers, long-term care residents, and so on and so forth. I think you can find that information at the on the state COVID page under the vaccination tab of their priorities that they just put out today, I believe, in regards to kind of the priority groups of how we will work through those vaccination clinics.
Thank you.
And sorry, we were, allocations are scarce, so when we got our first allocation day, we got 195 doses.
Council, any other
Yeah,
questions?
the only thing,
Go ahead, please.
oh, I was just going to add is, yeah, what we're advising patients right now, just generally healthy members of the public, we're anticipating will be some sort of mass vaccination event in spring sometime. Like Jason mentioned, healthcare workers, frontline workers are happening now, and elderly individuals, high-risk individuals, people with comorbidities, that will be sometime in between now and the spring, but lots of unknowns of, we know there's 70 vaccines in development. Pfizer is out, Moderna is coming next week, and there's just lots of unknowns, but that's what we know at this point. Our general public will be sometime in spring of 2021.
Thank you.
Council, any other questions, the experts that called in for us to help us? Well, thank you to all you that took out of your evening to help provide information for us and the public, so thank you. This time, public comments still open. Anyone else care to speak to this?
Bradley Walker, resident of Brookings. Is the gentleman from the Brookings Hospital System still on the phone? I have a question, a couple questions, actually. If he's not, it's okay.
I don't think he is.
If he's not, it's okay. Anyway, I'm here tonight to oppose the extending of the ordinance. As I stated earlier, 2 of the 4 metrics have been met to move forward. As per your memo, you state staff recommends extension. We have determined at previous meetings that there is no staff, but it is in fact the city manager who makes these recommendations. I would like to point out the manager's title is city manager, not citizen manager. You keep distributing manipulated data to further your agenda. Now, a few minutes ago, you had the data from the latest update on the screen. I wonder if you could post that back up there. Can you go up one more? No, the other way. Active cases. That on there. That's not one of the screens that you've included. Can you pull up the current alert for Brookings County from yesterday with all of the data on it that shows the Brookings data, the South Dakota data, the US data, the world data? If not, it's okay. But my point is, that I was trying to refer to shows you don't talk about the increase in positive cases since the mandate, which the graph clearly shows is an upward direction. On September 9th, the day after you passed the mandate, there were 538 total positive cases in Brookings County. Today, there is 2,735. Masks didn't flatten the curve. Masks didn't slow the spread. Neither did the restrictions on businesses. I have given you the infection rate for Brookings County before. It's probably with the decline in the active cases that we've had in the past few days. When I gave it to you before, it was 1 in 100 people. If there was 100 people in the room, one person would be infected. With the decline, now it's more. If there was 100, it's probably 1 out of, I'm guessing. I don't have accurate numbers because I don't have it here. Probably more like 1 in 125 people are infected. The hospitalization rate for the outbreak, and if you want to do the math with me, don't believe my numbers, you can go ahead. 94 cases have been hospitalized. out of the 2,735. If you multiply that by 100, that comes out to 3.4%. So only 3.4% of all cases have required hospitalization. That means 96.6 cases haven't required hospitalization. The death rate is 24 deaths divided by the 2,735 cases, multiplied by 100, which equals 0.87%. So the survival rate in Brookings County is 99.1%. People are not dropping like flies like mainstream media would lead you to believe. These figures do not support continuing down this road. People aren't going to throw caution to the wind because this ordinance is dropped. But with the way you have this threshold set up, there's no end in sight. Like I said, 2 of the 4 metrics have been met. The other 2 rely on testing, and according to this, their testing is not adequate. Even the numbers on your chart say you need to multiply the number of tests times 10. Why, I don't know, but anyway. The thresholds, there's no end in sight. And remember, council can revisit and reimpose the ordinance anytime should the data support it. Just like it can remove it at any time. As was suggested some time ago by Councilmember Brink, changing the restrictions to guidelines will give people the right to make their own decisions on their businesses and lives instead of being dictated on what they can and cannot do, such as celebrating the holidays. Table the extension or allow the ordinance and mandate to expire and start the new year on a positive note, because we sure don't want a repeat of 2020. Thank you.
Anyone else care to speak to ordinance 20-29?
Good evening. I'm Dr. David Meyer. I've been here earlier, back when we first started the mask mandate, and spoke in favor of masks. And then I resorted to emails in support. And then I followed how you were doing and agreed, so I kind of backed off. But now we're here to renew again. And with the vaccines coming on the scene, I just want to implore that we're almost there. We are almost there. And ask you all to continue to stay the course. There's going to come a time when we can take this ordinance off. I don't know when it is, but there will be that time. And the vaccines are coming to help us, but we still need the mask. And I implore you to vote to continue the ordinance. So thank you.
Thank you, Dr. Meyer. Anyone else care to speak to this? Okay, close the public comment. Council comments. Okay, Councilman Niemeyer or Councilmember Chilton Byrne, any comments?
This is Councilman Niemeyer. I wouldn't mind making a comment. As much recognition as we've got nationally and internationally of doing this so early as other towns were not in South Dakota, and the numbers that we've had, I know Mr. Walker made a comment. We had 1 death when we started the mask mandate, and now we have over 20. But if you look at the numbers on the other cities that didn't do a mask mandate until just recently, our death rate is quite a bit less. And I'm glad that we have more citizens that are alive than we could have if we didn't have this mask mandate to begin with. Everybody can use numbers to prove their point, but most of the numbers that we're getting are from professionals. They're all science-based. They don't have an underlying opinion behind them, and they're truly helpful for us to make decisions. And like Dr. Meyer said, we're almost there. We've heard now that the vaccines possibly might make it to us by this spring. Hopefully the majority of us take them, and we can move on and put this all behind us. So I personally will be in favor of extending this mandate, and we can review it at any given time, obviously, and move on. Thank you.
Thank you. Any other council members? Please call the roll.
Corbett,
Aye.
Niemeyer,
Aye.
Tilton Burn,
Aye.
Wendell,
Aye.
Brink,
No.
Collins.
No.
Okay, ordinance 20-29 is extended. Now we'll get in, there are no contracts or change orders. Screen back up there. And all right, under ordinances, first reading, you know, no vote is taken on the first reading, but we certainly offer the opportunity for council to comment or the public to comment on this. So I'll turn it over to Community Development Director Mike Struck.
Thank you, Mr. Mayor, members of the council, and those public in attendance. Ordinance 20-025 is an ordinance rezoning 22 acres of property in the River Run addition just west of Valley View on the south side of 20th Street South. The proposal is to rezone from an residential district to an R3, which is an apartment district. There is a preliminary plat that was accompanied with this proposal that will come before you at the second reading. We need the zoning in place before we can take action on the preliminary plat. But this is a single-family residential subdivision that the developers are proposing. I just want to point out a couple of things with this particular rezoning request is the project that is proposed for this area is consistent with your 2018 to 2023 strategic plan, specifically supporting housing and amenity development initiatives needed for workforce sustainability and stability. It's also consistent with numerous policies within our comprehensive plan dealing with the expansion of housing diversity by type and cost, also implementing the intensity-based land use philosophy that was proposed within our comprehensive plan. The future land use calls for medium density residential development in this particular location. That equates to approximately 4 to 12 dwelling units per acre. The developers are proposing 85 single-family residential lots in this area, which equates to 3.86 dwelling units per acre. So even a little bit less than what the comprehensive plan had proposed for this particular area. Part of the reason for the R3 rezoning request is the developer is proposing a housing type that isn't commonly seen in Brookings, and they are proposing what's called the single-family attached 0-foot side yard. And so with that, there are a few areas in town that have this, but they're on larger lots. They're a little bit higher price points. They are proposing something that could be a starter home for a first-time home buyer. Could be somebody that would be in our school system or in our healthcare industry, a recent graduate, that would allow them the ability to get into a home ownership opportunity. So with this, what is required with the frontage requirements is 75 feet, I believe, for the lot and 9,600 square feet. And so you build it similar to like a twin home. They do construction methodologies that would allow them to, upon completion, be fire rated, and you could survey and split the parcel down the common wall and create two separate parcels that the land would also be sold with each side of the unit. What we typically see in Brookings is twin homes that are eventually become rentals, and they can't quite meet these requirements. We had a lengthy discussion at the Planning Commission on this proposal. And the big reason why they did not seek a different zoning designation that could be done under the R1D single-family residential district is you'd end up losing at least a minimum of 5, maybe 6 lots, which then drives up the cost of housing for the rest of the development, and you eliminate the possibility for a couple of other individuals or families to gain homeownership opportunities. So with that, the Planning Commission did recommend approval of the rezoning on a 7-0 vote. The Development Review Team and staff also recommend approval, and I'd stand for any questions that you may have.
Councilmember Brink?
I noticed in the planning commission meeting about drainage, concerns about that. Is there anything you'd want to say about that to help us?
Well, the drainage plan is being worked on, and that'll be part of the preliminary plat approval process. That isn't necessarily part of the rezoning process, but they are working on that. There are 2 detention ponds proposed for this development, one in the northeast corner and one in the southwest corner. There's kind of a breaking point where about the northern third or so would drain to that northeast pond, and then the remaining 2/3 would go to the southwest.
Thanks.
Councilmember Collins, did you have a question?
Hey,
Comment?
Mike. I have a couple questions. I've received a couple phone calls on this this past week. Some of them were worried about the traffic on 20th Street South. 'Cause the last time we did construction around that area, it was quite inconvenient for some of the people that live in that area. Is there anything that's going to work better this time?
We would, at some point in time, when the funds are available through our CIP, we would do a reconstruction. That was Brookings County road that the city took over jurisdiction on, and then we just, through our budgeting process, we saved up the funds to reconstruct that and expand it to a 3-lane. We didn't have enough funds to extend it all the way to the western edge of city limits, so we stopped just at the west edge of the Valley View addition. At that particular time, we didn't know that this project was coming forward when we were designing that. So it's just a matter of we'd have to budget appropriately through our CIP.
Okay. I've had apartment buildings. Do you know exactly where they're going to be?
There are no apartment buildings with the
There won't?
project, and that's the part that's a little bit misleading, is the zoning district that was selected. The official title of the zoning district is R3 Apartment District, but within that district, it allows single-family, two-family, the single-family attached 0-foot side yard. The primary reason why they selected the R3 is because it does allow for a smaller lot area and smaller frontage requirements, so that they can build these single-family attached units and sell them individually. And if they were to go to a different zoning district, you're going to lose about, I think 5, maybe 6 potential homes that could be built in there. Now, the entire subdivision is not the single-family 0-foot side yards. There's a couple of different areas within the subdivision that have that, and then the remaining approximately 40 to 50 lots are your traditional single-family lots, very comparable to Valley View. Some of the single-family lots are actually larger than what is in the Valley View addition. So it's a very similar development, with the exception of the single-family attached units.
Okay, thanks, Mike.
Councilman Wendell?
Thank you, Mayor. Have you thought of a time frame of when this neighborhood might see connectivity with the existing neighborhood? I'm always happy to see new neighborhoods crop out, but I'm always concerned about how we connect them with sidewalks and how we ensure this new neighborhood will be connected, and what kind of time frame might we look at before that would happen?
I may have to defer on this particular topic, but it's proposed one connection out to the north to 20th Street. The connection from Rapid Valley Street and Valley View will extend west into this subdivision. There's a couple of north-south streets and I think 1 or 2 east-west connecting streets. And then there will be a requirement that the infrastructure and street is extended to the south to the property line. So if the adjacent property owner to the south were to want to develop, they'd have the ability to tie into the infrastructure and also have that street connectivity. Sidewalks are installed at the time that the home is constructed. Now, the shared use path that was just installed along 20th, that would be part of a city project with 20th Street South reconstruction.
I had and the developers and the staff. I think this is exactly what we were looking for as we started to kind of identify affordable housing as a priority, that it would require us to revisit existing zoning, that it would be connected to existing neighborhoods. And so I think this aligns really well with what our hopes were. We didn't know exactly what it would look like. I understand some of the language that's used in the new zoning district has caused some concerns in the neighborhood, but truly this is the type of affordable housing connected to an existing neighborhood, single family, these types of lot sizes at this potential price point that I think we were all hoping to achieve. So I'm excited about this development. I just want to see us make sure it's connected to the existing neighborhood as thoughtfully as we can. Thanks.
Thank you. Developers have any comment, or you?
Mr. Mayor and Councilman, 19 Copper Mountain Road, Brookings. Thanks for the opportunity to speak. If you look favorable on this ordinance, we kind of got hit in the head on the apartment concept that came through. I wish the language would change because we developed Valley View in 2008 and with the idea of single family. And part of Valley View that you see up there was R3, but we made a commitment to the community and the families to make that a single family thing and dedicated a park for that. What we have here is an opportunity for some starter homes, for people to get started on and build some wealth. And the connectivity will be there in anticipation of 20th Street being built. We're really happy to start back into this again. The help we had last time was a TIF, and I wish we could have it again. But we're at it. We've got partners that want to go. We want to get going real soon, weather permitting, and we hope to see homes up there. If there's any question, Kathy and I are sole owners of Blair Hill Properties, Inc., and this is our 6th development that we've done. So, any questions?
Thank you, Mr. Rounds. So you sent yourself up instead of sending Kathy up, but I get how that works.
Okay.
Any
Nick
comments?
Corbett?
Oh, yes. Member Tilton Burn.
I am curious to know what the anticipated price point is for the homes.
You're asking Keith Rounds. This is Keith Rounds here again. We're not going to build a home. We're just going to make the land available. In Valley View, we had a turnkey operation that worked out real well. But at this time, I can't really speak about it, but there'll be some very entry level. If in the near future, you'll hear about what our plan is to get some very, very entry level plans going for a majority of this. So I wish I could tell you. But the price of OSB and things going up, it's really tough to price out a house right now, so.
Thank you,
Thank
Mr.
you.
Rounds. Okay, there'll be a public hearing on January 12th, 2021. Oh,
I just wanted to look, I can't really see the line.
you got to come up to the mic so they can hear, so it's recorded.
I just had a clarification on the, I'm really bad with geography in this area. So the area that you're talking about that's Western Avenue on the right-hand side there. So you're talking about the area west of Western Avenue. So Mr. Collins addressed the problem about traffic. So what you're telling me is even though you just paved all that area, you're going to tear it up and do it again? Or has the improvement that you made so far gone west of Western Avenue?
Have Community Development Director address that. I think I know the answer, but we'll let him.
So the 20th Street project that was just finished, it extended just west of Rio Grande Avenue, which is the furthest north-south street on the map up there. So the area that's being proposed is highlighted in yellow. The improvement stopped right where that cursor is.
That's how far you've gone so far?
Correct.
Okay.
So we're not tearing up any of the existing street infrastructure that was just completed this construction season.
Okay, well, I just thought that you said that you were gonna widen it one more lane than it was before. I just noticed that you guys just put in streetlights on the south side of 20th Street. I don't know how far they went. I can only see from Maine
So-
down past the new apartment complex. I can't see over the hill.
So they'll,
I haven't driven down that far.
so the existing 20th Street South project took the previously county road that was 2 lanes with maybe a foot, maybe 2 feet of shoulder on either side, and widened it to a urban standard, lowered the road, installed curb gutter, storm sewer, and made it a 3 lanes wide so that there'd be a center turning lane wherever there's those intersections. And then there's a shared use path put on the south side, and then the streetlights upon completion were being installed all the way from Main Avenue all the way to the west edge of that construction project, so that would serve the Valley View addition. And then it stopped at that point in time for a couple of reasons. One, funding. 2 is we didn't know timing of development further west. In hindsight, knowing that this project is coming forward, and if the funds were available, it would have been nice to complete it all the way, even further west. But that'll be a project in the future that we'll have to undertake.
Okay, thanks, Mike. Why don't you go ahead, as long as you're up here, on ordinance 20-26.
Thank you, Mayor, members of the council, and public at home. Ordinance 20-026 is an ordinance for a conditional use permit for a major home occupation. We have an individual at 1420 Lagueros Drive who would like to convert a portion of his residence for a small CNC machine and 3D printer. Per our current ordinance, it's anticipated to take up just over 500 square feet, but less than 50% of the square footage of the main floor of his residence. So it's put into that major home occupation classification. He is not anticipating any sort of on-site sales. This is more small little parts that customers would ask him to make, and then he would ship them via the mail or package carrier delivery service. This is something that would be consistent, once again, with your strategic plan and trying to encourage the expansion of the entrepreneurship program in the Brookings, and to kind of help support small entrepreneurs, give them the ability to get started, hopefully grow their business, be successful, and someday hopefully be forced to move into a larger space in a commercial or industrial setting. The Planning Commission did vote 7-0, recommending approval of the conditional use request. I'd stand for any questions that you may have.
Anyone else care to speak to this? Okay, there'll be a public hearing on January 12th. Thanks, Mike. Ask our CFO to come up and speak to Resolution 20-108.
Good evening. This resolution seeks approval for a short-term interfund loan from the general fund to the above Sheldon Complex, the capital project, in the amount of $3.03 million. This initiative would result in around $15,000 savings in interest expense for the city, and would go in line with the strategic initiative of maximizing the use of our resources. This will be a short-term loan of around a little bit over 4 months at a 0% interest rate. After this period, the general fund would be paid in full, and the bond would be drawn to pay the general fund. Any questions on this?
Councilmember Brink.
So the $15,000 savings is reflective of any closing costs or other costs related to the loan?
Yes, so technically what we're doing is just, we're not drawing on the loan until the last day that we can draw on. So there's no really transactions with the bank whatsoever or change in the original loan.
Okay, just a creative internal financing maneuver to save us money.
Because we have the liquidity right now to do that.
Good thinking.
Thank you.
Okay, entertain a motion to approve Resolution 20-108.
So moved.
We have a motion, a second. Any public comment on this one? Council comments? Yes.
If I could, I would just mention, this is just one of those great internal opportunities that our staff brings to our attention. Opportunity to save $15,000 utilizing our own cash. Staff is doing this daily, on a daily basis. So I appreciate staff being innovative with the tools that we have available.
Council comments? Please call the roll.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Brink,
Aye.
Collins,
Aye.
Corbett.
Aye. As the city manager said, thank you for this innovation and saving money.
Thank you to all the finance office too.
And next, Resolution 20-109.
Hello, so this resolution is requesting authorization to transfer funds from the senior city manager's contingency account of about $63,500 to fund litigation, software licenses, and holiday employee recognition expenses. These are mostly unforeseen expenses at the time the 2020's budget was approved. After this transfer, the contingency account would still be funded at $57,000, and there is no incremental 2020 budget impact due to this. Any questions on this?
First, entertain a motion to approve.
So moved.
Second.
We have a motion and a second. Any public comment? Council comment? Please call the roll.
Tiltonburn,
Aye.
Wendell,
Aye.
Brink,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer.
Aye.
All right, Resolution 20-109 is approved. Now call on City Manager to introduce Resolution 20-111.
Thank you, Mayor, City Council members. The City Council annually commits funds for non-for-profits. Not all of the 2020 outside agency funding was expensed this year, and due to COVID-19 pandemic, additional funding response is needed to support our local community. The recommendation is provided by staff to increase the 2021 non-for-profit funding by $41,000 from the 2020 unspent funds. If approved, social services would be available funding would increase to $266,486 from the $225,000. The current request for all city funding is at $295,000. All social service requests for the city funds were received through the new United Way process, and after the first of the year, council will be presented with these outside agency recommendations, as well as an ordinance solidifying the total dollar amount that council contributes. I would be more than happy to answer any questions you might have, and also Heidi from the United Way is here to answer any questions of the process as well.
Let's have a motion to approve.
So moved.
Okay, motion and a second. Any public comment? Heidi, you want to speak to this or just stand by or? Okay. No public comment. Council comments or questions? Please call the roll.
Wendell,
Aye.
Brink,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn.
Aye.
Resolution 20-111 is approved. Final action item is action on the city manager's compensation package. So the public knows that the council has the opportunity to vote on or evaluate the city manager, as does the employees in Brookings evaluate. And the council has had the opportunity to review this and went through this and discussed. And at this time, the council is recommending a 3% pay increase for the city manager, which would set his base pay then at $158,829.58. Entertain a motion to approve.
So moved.
Second.
We have a motion and a second. Any public comment?
Yes, I do. Bradley Walker, resident of Brookings. It is very puzzling to me how you can even be considering additional compensation for the city manager. I still don't understand how, at the council meeting on June 9th, the council, after hearing multiple citizens comment on the negative financial impact of the city's ordinance have had on their lives and businesses, voted unanimously to raise the manager's salary 3%. Mr. Collins was not a member at the time, so he did not, but everyone else did. The manager makes over $150,000 a year, and at a time when businesses are struggling to survive and citizens are unemployed and deemed non-essential, You, the council, deemed this not sufficient and voted to increase it. Doesn't seem to be a very wise decision to me, and certainly not fiscally responsible. And now you deem that that wasn't enough and want to increase it again? So you increased it 3% in June. And now you want to increase it 3% again for a total of 6% raise in a year? When people are unemployed, struggling to survive, businesses are struggling, and you want to give the manager some more money? I just don't understand. I don't think it's very, like I said, it's not very fiscally responsible to give this gentleman, or it doesn't matter if it's him or whoever it is, the city manager, regardless of the person in the position.
I think maybe what I can do is clarify for you a little bit, Bradley, what took place there. Yeah, it looks like 2 raises in 1 year, and that's the way it looks like. But what had happened is I was supposed to be evaluated last December. Council didn't have the opportunity to evaluate me last December, and they prolonged that evaluation until June when they had the opportunity to meet together as a team to evaluate me. So really what I did is I prolonged any increase that I would have had in December to June until they had an opportunity to evaluate me. So really that increase I got in June was supposed to be had last year. But once again, the council has to take into consideration all the different surveys and instruments and then review it as a team to come up with that evaluation. So theoretically, my evaluation is supposed to happen every December.
Okay, I mean, that may be so, but my point is, I don't think anybody should be getting a raise from this city council at this point in time when the city and citizens are struggling to survive. That's my point. Nobody, nope, okay, I'm not nobody, but very few people are at your income level. I know everybody would like to be at your income level, but with your income level the way it is, and the situation of the unemployment and the lack of businesses struggling, I don't think it's appropriate at this time to give the city manager any more compensation. Thank you for your time.
Council comments or questions? Councilman Wendell?
Thank you, Mr. Mayor. I think for those watching at home, I would want to. When we applied the 3% increase in June, we provided the context that you just noted, that our city manager's evaluation and the application of a potential increase had been delayed multiple months. And so that really was a retroactive application of a very appropriate annual salary increase. We're now at the regular timetable to be revisiting our city manager's salary. We're looking at applying an increase that is comparable to the increases we're applying throughout city staff. So we certainly believe that those who are employed by the city of Brookings have had a Herculean task this year. As a council, we support applying an appropriate increase to their compensation. 3% certainly is something that we can handle as a city and we think is appropriate given the work that we've expected of our city staff. There are well over 100 staff members across the city of Brookings organization. I believe they deserve an appropriate annual compensation increase. Our city manager is included. His compensation increase happens to be more conducted in a more public forum, but it doesn't change the reality that it still follows the same process.
Okay, thank you. Any other council member? Okay. Seeing none, please call the roll.
Brink?
Aye.
Collins?
Aye.
Corbett?
Aye.
Niemeyer?
Aye.
Hilton Byrne?
Aye.
Wendell?
Aye.
Okay, thank you. Okay, council member, any other topic for future discussion? Seeing none, entertain a motion to adjourn.
So moved.
Second.
We have a motion and a second. Any discussion? Seeing none, all in favor say aye.
Aye.
Aye. Good night.